Hello, I'm Dr. Beth Jaklic, and I'd like to go over with you the instructions for your colonoscopy preparation. These instructions are very important as they can affect the outcome of your procedure, your safety, and the quality of your examination. So I appreciate your taking the time to carefully watch this video and make sure you read the written instructions carefully as well. We really need your colon to be pretty squeaky clean in order to see what we need to, and to spot small polyps or lesions if you have any. There are some things you will probably have to do at least 5 to 7 days before your colonoscopy. First of all, if you are taking any type of blood thinners, aspirin or platelet inhibitor like Plavix, you will need to make sure that our office is aware of what you are taking and that we tell you what you should stop and what you should not stop. You should not stop any blood thinners, aspirin, or platelet inhibitors without the okay from our office. Our goal is to have you on as few blood thinners as possible, ideally none, but we have to make sure that it is safe for you to stop them. So again, make sure you have a clear okay from us to stop aspirin, antiplatelet drugs like Plavix, clopidogrel, etc., or blood thinners such as Coumadin, Xarelto, Pradaxa, Eliquis, etc. Our office may need to contact you or your primary care physician, cardiologist, or neurologist to make sure it's okay to stop these, and we will tell you when to stop them. If you have any questions about any of the above, make sure you call the office at 757-412-4919, or if necessary, the on-call nurse at 757-620-6612 and get clear about what you need to do. We also ask that you not take any non-steroidal arthritis or pain medications like Motrin or ibuprofen, Advil, Aleve, etc. for 5 to 7 days before the procedure. Tylenol or acetaminophen, on the other hand, is fine to take and can be a good substitute for these medications in the meanwhile. Now for the prep itself. While there are a number of different preparations for colonoscopy, our preferred preparation is called Suprep and is available by prescription through your local pharmacy. You will receive a prescription for the Suprep from our office and take it to your pharmacy. We recommend that you do this well ahead of time in case there are any issues with availability or insurance. Alternately, we can fax or call the prescription in for you. Our alternate prep is Miralax, which I'll discuss more in a minute. Both preps are split into 2 doses, which really improves the quality of the prep. On the day prior to your procedure, you will start by taking only clear liquids from the moment you wake up. These include things like juices with no pulp, apple juice, white grape juice, bouillon, broth, black coffee or tea, Kool-Aid, sports drinks like Gatorade, ice pops, and plain Jell-O. Please do not take any milk products, solid foods, smoothies, alcohol, or anything colored red or purple. All of these instructions are written in the handout and available on our website as well. Between 4 and 6 p.m. on the day prior to your procedure, you begin the laxative part of your prep by taking the 6 ounces of Suprep and mixing with cool water in the 16-ounce container provided in the Suprep kit. Drink this 16 ounces quickly and then follow it with 2 more 16-ounce containers of clear liquids within the next hour. You'll need to stay near the bathroom at this point, no kidding. The prep usually starts working within an hour or 2 for most people, but can take as long as 5 hours to start. This will be the first part of your 2-part cleanout, and you will complete the second part of the following morning. Some people find the taste of Suprep tolerable and others find it to be fairly troublesome. The important thing is to drink it all and keep it down if at all possible. It does help to make it cold. Pinch your nose closed while drinking or drink through a straw and drink it quickly. Early in the morning of your procedure, 5 to 6 hours before your colonoscopy is scheduled, you will take the second identical dose of Suprep. Mix the 6-ounce bottle with water in the 16-ounce provided container, drink the container, then follow with 2 more 16-ounce portions of clear liquids over the next hour. You can continue to sip on a little water until 4 hours prior to your procedure. After this, please do not put anything in your mouth besides medicines with a sip of water and, of course, your toothbrush. At this point, you are complete with your preparation. Your bowel movements should be watery and a thin, see-through yellow or light brown. Congratulations. If at any time you have questions or problems during your prep, please call our on-call nurse at 757-620-6612 and have any questions or concerns answered. While the preparation is somewhat difficult for some people, virtually everyone can get through it, and the more you are able to adhere to the instructions, the better your preparation and visualization will be on your examination. Finally, for patients with impaired kidney function or those unable to purchase the Suprep prescription due to cost or availability, there is an alternative preparation using Miralax and Dulcolax. We do recommend the Suprep because it's generally less volume and easier for people to take, and the preparation is generally better with better visualization on colonoscopy, cleaner prep, etc. However, if you simply cannot swing the Suprep or are a patient with impaired kidney function, please read the instructions called Alternative Preparation for Colonoscopy, Split Dose Miralax and Dulcolax. The instructions are very similar to the Suprep instructions, but you will purchase Miralax and Dulcolax at the drugstore, non-prescription or over-the-counter, and follow the directions that we supply you. Again, you'll be taking the preparation in 2 split doses, 4 to 6 p.m. on the day prior to the colonoscopy, and then again early in the morning, starting 5 to 6 hours prior to the time of your procedure. Again, all of the directions about aspirin, blood thinners, etc., and the clear liquid diet are the same as for the Suprep. We still recommend Suprep if at all possible, but if this is not feasible, then follow the alternative preparation directions. Finally, it's important to know that the clear liquids themselves are an important part of your prep. They help to flush your system and they will keep you from getting dehydrated, so drink up. You'll feel better and the prep will go better. And if you happen to tend toward constipation, it's also helpful to make sure that you pay attention to drinking plenty of liquids for the entire week prior to your colonoscopy. Virtually all patients agree that the preparation for the colonoscopy is the only difficult part. When you arrive at our office, we'll get you situated and you will have a very nice, side effect-free anesthetic and have virtually no experience of the colonoscopy to speak of. So the important thing is getting yourself prepped and ready to go. We will take care of the rest. Again, if you have questions or concerns or worries about anything, call the office or the on-call nurse and we will address those concerns. Thank you, and we look forward to seeing you soon.